Can scoliosis treatment cure scoliosis? Unfortunately, scoliosis is a progressive condition, meaning it's its very nature to become more severe over time. And we know scoliosis treatment is really about managing the scoliosis condition, meaning in most cases, we don't know what caused the scoliosis. In majority of cases, scoliosis are diagnosed as idiopathic. And idiopathic scoliosis, by definition, means that we don't know what caused the scoliosis. And we consider it to be a multifactorial problem, meaning there could be many different variables associated with the causation. And the theories go very deep. There's 70, 80 plus theories on causation. And more likely, most people have many different variables associated with why their scoliosis has developed. However, by the most of the time we found scoliosis, what caused it can almost be irrelevant, meaning even if we knew what caused it and we could eliminate the cause, now the scoliosis, because it's a structural condition, the scoliosis itself becomes the cause, because a structural condition will worsen over time because the structure itself is still there. So for example, just theoretically, let's say a lack of vitamin D caused the scoliosis to occur. Make this really simple. And the person develops scoliosis. And now they go out throughout their life, they start growing, and the curve starts to get bigger, and they start having 20, 30 degree scoliosis, and they're diagnosed. You can now replace that person's vitamin D back to normal level. Their spine isn't just going to straighten now because they have grown with scoliosis and it's become structural. And as they continue to grow, the structural component of the scoliosis will grow with them. So this is where sometimes knowing the cause will be irrelevant towards treating the condition, because even though we can't cure it, we must address it structurally. So this is why waiting and letting a curve become bigger is almost letting the very reason why scoliosis worsens when they grow, letting it become bigger, even though we don't know why the scoliosis happened. Treating the size is the way you treat the cause of scoliosis, because eventually the size of the scoliosis is what's causing it to worsen. So even though we know scoliosis is a progressive condition and there's no curing scoliosis in particular, like what caused it, but we know scoliosis is highly treatable, because what makes it worsen is that as it gets bigger, it's more likely to get bigger. So if we can particularly treat curves, especially when they're small, and keep the curve smaller, we are effectively treating what's causing it to worsen, which is the size. So therefore, early detection is one of the most important things in finding a scoliosis, and then treating it at that early time in its milder form is by far the most effective way in controlling the size of the scoliosis. The milder scoliosis is, the simpler it is to treat. Diagnosing scoliosis when it's mild and treating it when it's mild is very beneficial, because this proactive treatment, like I mentioned, will control the size of the scoliosis. And it's the very size of the scoliosis that tends to increase the risk of progression. So by controlling the size, you're controlling what's causing it to worsen. And early intervention means treating the scoliosis when it's mild, when it's more flexible, and it's more likely to respond. Now, we know scoliosis cases can worsen, and they can worsen to become very severe, where scoliosis surgery can be considered a type of treatment. And scoliosis surgery is a type of spinal fusion. Even though most cases of scoliosis don't need spinal surgery, if curves worsen to severe levels, they may be recommended spinal surgical fusion. And this is where they fuse the most tilted vertebra on the top of the curvature to the most tilted vertebra on the bottom of the curvature. They use rods and screws to hold the spine in place, while bone grafts in between all the vertebrae will take fusion and they'll fuse the spine. And the goal of spinal fusion is primarily to stop curve progression. So they're trying to stop the curve just from worsening. This isn't a cure. They're not curing scoliosis because they don't know what caused it. They're just doing the same thing that we will be doing conservatively, is controlling the size. It's basically the same thing as working towards corrective results through a non-surgical treatment, but it's done surgically with rods and screws. Now, we know non-surgical treatments, we call them corrective results. Corrective results means that we're reducing the size of the curvature, because it's the very size that really deals with how much the curve worsens. And even though it's not addressing what actually caused the curvature to occur, it's addressing the manifestation of that through the increased size of scoliosis. And this is typically combining many conservative treatment programs into one program to provide the very best results. And normally a patient will go through a sequence of treatments that combines chiropractic care, physical therapy, scoliosis exercises, corrective bracing, home rehabilitation and exercises. And normally the person is monitored in a way kind of like orthopedic braces or orthodontics braces, where you're trying to reduce it and stabilize it, reduce it and stabilize it, reduce it and stabilize it. And this conservative treatment is proactive, so we can do it very early before curves become severe. And when we treat these curves in early sizes, we can prevent the curves from worsening, and we can decrease the symptoms and definitely the need for invasive surgical treatment. Now, the benefits of treating scoliosis without surgery are very, very wide, meaning non-surgical treatment we know is safer. We know it's definitely more natural. It's definitely much less invasive. It's going to be less intrusive over someone's life. There's less complications associated with the treatment. We know it preserves spinal function. It doesn't remove spinal function. So therefore, there's tremendous benefits to conservative treatment. And of course, there tends to be less expense associated with it. Conservative treatment uses a combination of chiropractic care, and this is normally through adjustments and corrective spinal adjustments to help improve the curve's most tilted vertebrae and try to improve the position of these and the mobility. It uses physical therapy, typically in the clinic, and these are normally passive therapies that are traction-based or therapeutic approaches to help improve flexibility. It uses specific scoliosis exercises to help mirror the scoliosis presentation that are prescribed for that particular patient to help make the surrounding muscles of their spine more stable, to make the spine stronger. And it typically can also improve corrective bracing to help improve the shape of the torso. We know a fused spine potentially is weaker and more vulnerable to injury. So therefore, fusing a spine is completely contrary to the basic spinal anatomy. The spine is a movement-based system, and it's designed to improve flexibility and protect the spine at the exact same time. Patients that have spinal fusion definitely notice a decrease in flexibility, and spinal range of motion is definitely a fact. So we know spinal surgery comes with some serious potential risks and side effects and complications, where none of these are typically associated with conservative treatment. There's never treatment guarantees, but we know early detection and early intervention, there's much fewer limitations. And even though we can't tell you what caused your scoliosis in the majority of cases, if we control the size, we're definitely controlling what's causing the progression, because what typically causes progression in the majority of idiopathic scoliosis cases is the curve getting bigger. So as the curve gets bigger, again, the risk goes up with it. So if we can control the size, we can control what's causing it to worsen, and therefore the majority of cases don't need scoliosis surgery, especially if they're treated conservatively at mild sizes. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.